Bismillahirrahmanirrahim. Assalamu alaikum. My name is Aisha Mashal. In this video, I'm going to discuss shoulder major movements and muscles responsible for these movements. Starting with the shoulder horizontal adduction, as this movement is being performed in horizontal plane, that's why we are calling it horizontal adduction. It will be performed by that major muscle which is present on the anterior aspect. The other movement is shoulder horizontal abduction. It will be performed as demonstrated here, and the muscle which is going to be responsible for shoulder horizontal abduction is deltoid posterior fibers. Moving forward, shoulder abduction which is being performed in frontal plane, it will be performed by middle fibers of the deltoid muscle. As you can see, this movement is being performed in this direction, upper direction. So the muscle which will be responsible will also be those present here on upper aspect, which are deltoid muscles, and it will be the middle fibers which will be responsible. Moving forward to shoulder flexion, which is being performed in this direction. So the muscle which will be present on this aspect will be responsible for shoulder flexion, and the muscles which are present on this aspect are deltoid anterior fibers and coracobrachialis. Deltoid anterior fibers are present here on this aspect, and coracobrachialis, which is present here, will also be responsible for shoulder flexion. The other movement is shoulder extension, which is being performed like this. So the muscle which will be present on posterior aspect will be responsible, as the shoulder extension is also being performed in posterior direction. So muscles which are present on posterior aspect here are latissimus dorsi, which is a long muscle present on the back side. The other muscle is teres major. Teres major is a muscle which is present on the posterior aspect of scapula. Moving towards the shoulder lateral rotation, it can be performed by moving the forearm externally. Two muscles are responsible for shoulder lateral rotation, and the first one is infraspinatus, the second one is teres minor. Infraspinatus is a muscle which is present on the posterior aspect of scapula, and just below the infraspinatus there is a small muscle, teres minor. Both these muscles are going to perform shoulder lateral rotation. The last movement which we are going to discuss in this video is shoulder medial rotation, and it can be performed by moving the forearm internally. So subscapularis is the muscle which will be responsible for shoulder medial rotation. Subscapularis muscle is basically present on the inside of scapula, inner aspect. So this is the muscle. Here a coastal view is shown in this picture. I hope this video is going to be helpful in remembering the muscles responsible for shoulder major movements. I've added pictorial demonstration of movements as well as diagrams of muscles, so I think it is gonna be easy if you perform movement side by side by yourself, and then just imagine that okay, this movement is gonna be performed by this muscle, as this muscle is present here, and then I think it is gonna be easy. Thank you for watching.